So early this morning came this news break that Shreyas Iyer suffered a laceration of the spleen. That is something that we are here to understand. I'm delighted to be joined by Dr. Bharadwaj, who has over 2 decades been treating sports injuries. He understands this extremely well. Dr. Gaurav, firstly, thank you so much for making time and speaking to us here on Sports Today. The world wants to know right now, what does it mean? First, let's begin with the spleen. Tell us where exactly that, because images that we saw on live TV, we saw him holding his rib cage. But where exactly is the spleen placed? And then we'll get to what laceration of the spleen means.
Okay, namaskar, and thanks for having me on the show. So, as you said, that all of us saw that how he took that catch, and then he pressed the ball against his left rib cage, and then he was sandwiched between the hard ground and the
Mhm.
ball hitting on his lower left rib. Now, if most of us can remember a very famous actor who had his spleen injured during a film shoot around 40 years back. It's a similar injury, and that's always a concern.
Okay.
So the spleen is a part of abdominal organ which is very vascular. It means it has got a lot of blood stored in it because
Okay.
it's type of a filtering infection in our body. So it's always rich in blood. And the laceration of the spleen, it bleeds very vigorously. It's
Okay.
a very, very serious situation because a person can bleed out of his complete blood volume in minutes because of this injury in severe cases. So we all are extremely lucky that he was well taken care of and he received the right management.
You're talking about Mr. Amitabh Bachchan, right? The time that I think it was Coolie, during which
Yeah,
he got that injury.
yeah, exactly. So it was a similar type of injury and which unfortunately Shreyas received.
Okay, now the laceration of the spleen. Laceration to the layman, I think, would mean a tear. Is that exactly what it means then? That the spleen tore in this particular case of Shreyas Iyer?
Yeah, so what happens that there are two scenarios. Either the artery, which is a tube taking blood in and out of the spleen, that gets disrupted, and then there is a leakage of the blood because the tube has the rupture, or
Okay.
the actual organ, which is the spleen, which has a tear in
Okay.
it, and then there is the blood coming out from it. The major component which confirms or which determines that how bad is the injury, that whether
Mhm.
the overall lining is intact or not. Because if the overall lining is intact, then there's something to contain that blood coming out in the abdomen, like a free gush. So
Okay.
fortunately, this injury seemed to be self-contained. So people can actually rely on a natural clotting mechanism and the healing potential of the body to heal itself. But in case where the bleeding is happening uh, uncontrollably, then we need to go surgically to control that bleed.
Okay. Okay. So in his case now, tell us what the procedure could look like. We're hearing that he could be still in care for about a week. The BCCI will be monitoring his progress. But tell us what this week could look like for somebody like a Shreyas Iyer.
Okay, so luckily he's athletic, he's very fit, so all
Mhm.
his cardiovascular reserves are good. What he'll be observed for is that bleeding is controlled. His
Okay.
normal clotting mechanism is able to control this bleeding, contain the bleeding, and with the self-healing, this tear heals. Till then, he needs to be monitored very closely with daily scans to see that whether the amount of the blood which was to start is not increasing, to see the leaking is not continuing. So
Hmm.
it's called resolving of the blood. So if a blood result is getting better, blood loss is getting better, it means
Yeah.
he's on the mend. But he needs to be under close observation to see that if at any point it's seen that the blood loss is increasing, it
Hmm.
means they may need to consider a surgical option to go in and control the bleeding by surgical means.
Okay, I want to take two questions with you, but since we're running out of time, if you could just answer these two questions very quickly for us. One, what's the average recovery period? Like we're hearing it could be upwards of 3 weeks. So if you could tell us exactly what sort of recovery timeline we should be prepared for as cricket enthusiasts. Two, what is going to be the key for Shreyas Iyer going forward? Does this at many a time, would this injury be some sort of an impediment for him going forward, or you once you recover, you can just resume life normally?
Okay, at least 5 to 7 days in the ICU to monitor him closely.
Hmm?
Then he should be up and about, out of hospital, but he will be out of action for minimum of 3 months. The rib, which serves as a barrier, a cage to protect these organs, they need to heal completely. The spleen need to heal completely to take shocks and jerks. So
Okay.
minimum we are looking out 3 months of missing out Shreyas on the ground.
Okay, and what is the one thing he needs to be very careful of going forward?
Uh, See, once it healed, he should be fine. But as
Okay.
long as possible, he should be avoiding a direct impact on this area, like a
Okay.
crowded place. Even an elbow can do that. So to start, he has to be very careful.
Appreciate your joining us, sir, and giving us perspective that tells us so much about what is it that the next few weeks and the months for Shreyas could look like. But firstly, for first and foremost, for helping us understand the nature of this injury. Thank you once again for joining us here on Sports Today.
Pleasure and best wishes to Shreyas.
All right. Thank you.